Welcome all to new podcast. Today topic scapula. It is a large triangular flat bone lying at the posterolateral aspect of the chest wall opposite the second to seventh rib. Following are the parts of the scapula. It possesses two surfaces, three borders, three angle and three process. The surface is costal and dorsal surface. Border border, lateral border, medial border and upper border. Three angles, superior angle, inferior angle and lateral angle. Lateral angle bears the pear-shaped articular surface called the glenoid cavity. Processes. Three processes of the scapula, spinous process, acromion process and coracoid process. The how you determine the side of scapula. Glenoid cavity should face forward, laterally and slightly upwards. The dorsal surface bearing the spine should face backward. The inferior angle should face downward, and coracoid passage should point forward and slightly laterally. The surface. Now the description of the costal surface. It faces forward and medially. It is concave and hollowed, called the subscapular fossa. What is the other name of scapula? Shoulder blade. What type of bone it is? It is a irregular flat type of bone. The attachment of the costal surface. Subscapularis muscle arises from nearly the whole of the surface except near the neck. Serratus anterior is inserted on the surface along the medial border. The first and second digit of muscle extend from the superior angle to a point opposite the apex of the spine. Third and fourth digitations extend from the spine to the upper part of the inferior angle. The fifth to eighth digitation are inserted into a oval area at the inferior angle. Now the attachment of the dorsal surface. The dorsal surface of the scapula is divided into two parts by self-like position called the spinous process. The upper smaller part is known as the supraspinatus fossa and lower larger part is known as the infraspinatus fossa. These two fossae is communicate with each other through spinoglenoid notch which lies between the lateral border of the spine and dorsal aspect of the neck of the scapula. Through this notch, the supraclavicular nerve passes. Suprascapular nerve passes. Through this notch, suprascapular nerve passes. Now, the attachment of the dorsal surface of the scapula. Supraspinatus, it originates from the medial two-thirds of the supraspinous fossa. Infraspinatus, it arises from infraspinatus fossa. Teres minor, from the upper two-thirds of the flattened part adjoining the lateral border. The teres major from the lower oval part adjoining the lateral border below teres minor. Latissimus dorsi, some fiber from the dorsal surface of the inferior angle. Now, lateral border. or axillary border. It is thickest of all borders, extend from the lower part of the glenoid cavity to the inferior angle. Infraglenoid tubercle, a rough raised triangular area below the glenoid cavity. Attachment. Origin of the following muscle. Teres minor from the upper two-thirds of this border on the dorsal surface, teres major from the lower one-third on the dorsal surface. Between the two muscles is a groove for circumflex scapular artery, which is the branch of subscapular artery. You see, the name of the muscle is teres minor, but its attachment is bigger than the teres major. Triceps brachii, long head of the triceps brachii, arises from the infraglenoid tubercle. Infraglenoid tubercle situated at the uppermost portion of the lateral border. It is the uppermost portion of the lateral border. Now the medial border. Longest of all border extend from the superior angle to the inferior angle. Attachment of the medial border. Insertion of the following muscle, levator scapulae, between the superior angle up to the spinous process. The rhomboidus major opposite the root of the spine, rhomboidus major between the spine and inferior angle. Now upper border. Thinnest and shortest of all border and start from the superior angle and extend laterally to suprascapular notch converted into a foramen by superior suprascapular notch converted into foramen by superior transverse scapular ligament which separate it from the root of the coracoid process. So the upper border is start from the superior angle and extend laterally to the suprascapular notch. The suprascapular foramen transmit suprascapular nerve to the supraspinous fossa and suprascapular vessel pass above the foramen. Attachment of the upper border, inferior valley of the omohyoid near the suprascapular notch. Now the angle. Inferior angle from where lateral and medial border meet. It lies opposite the seventh rib. Attachment of the inferior angle latissimus dorsi arises from the dorsal surface of the angle. The superior angle lies at the junction of superior and medial border. It is covered by trapezius muscle. Lateral angle bear the glenoid cavity, which articulate with the head of the humerus to form shoulder joint, also called the head of the scapula. Floor of the cavity is lined by hyaline articular cartilage. Neck is the constricted part adjoining the head. The supraglenoid tubercle is a small rough area above the glenoid cavity. Attachment. The long head of the bicep brachii arises from the supraglenoid tubercle. Glenoidal labrum. What is glenoidal labrum? It is present to the margin of the glenoid cavity. It is formed by the fibrocartilage and it helps to deepen the glenoid cavity and provide better articulation with the head of the humerus. The capsular ligament of the shoulder joint, margin of the glenoid cavity beyond glenoidal labrum, it encloses the origin of the long head of the biceps brachii. Now about the description of the three processes of scapula. At first, the spine of the scapula. It is a self-like projection on the upper part of the dorsal surface of the scapula, triangular in shape. It has three borders: lateral border, anterior border, and posterior border or crest of the spine. Lateral border is free, thick, and rounded, bound the spinoglenoid notch, which transmit suprascapular vessels and nerve to the infraspinatus fossa. The anterior border is fused with the dorsal surface. The posterior or crest of the spine is subcutaneous. It has two lip, upper lip and lower lip. Now, the attachment of the two lip of spine of the scapula. Upper lip of the spine of the scapula is concave, concave help to form the supraspinous fossa, and following structure is attached. The deltoid muscle, posterior fiber of the deltoid muscle, arises from the lower lip of the crest. The trapezius lower fiber inserted into the upper lip of the crest, and supraspinatus muscle arises from the upper surface of the spine. Infraspinatus muscle arises from lower surface of the spine. Now this acromion process. It arises nearly at right angle from the lateral end of the spine and project forward. It is also subcutaneous and overhang the glenoid cavity. It has two borders, lateral border and medial border. The lateral border continues with the lower lip of the crest of the spine at the acromial angle. The medial border short and is continuous with upper lip of the crest. It bears an oval facet for articulation with the lateral end of the clavicle. It has two surfaces, upper rough and subcutaneous and lower smooth. Attachment. Deltoid middle fiber arises from the lateral border and tip. Trapezius inserted into the medial border behind the facet. Coracoacromial ligament to medial aspect of the tip. The capsular ligament of the acromioclavicular joint around the margin of the clavicular facet. Now, the coracoid process. It arises from the upper part of the head of the scapula, lies below the clavicle. At first, it ascends slightly upward medially and then abruptly bent forward and laterally. Thus, it is divided into a ascending and a horizontal part. The horizontal part has lateral and medial border, upper and lower surface, and the tip. The lower surface is related to the subcoracoid bursa and subscapularis muscle. The upper surface presents conoid tubercle at the point where the coracoid process change direction, and trapezoid ridge extend forward and laterally from the conoid tubercle. Now the attachment of the coracoid process. Pectoralis minor inserted into the upper aspect and medial border of the horizontal part of this process. The coracobrachialis and short head of the biceps arises by a common tendon from the tip of the coracoid process, coracobrachialis lying medial and biceps laterally. The coracoclavicular ligament. It has a conoid part to conoid tubercle on the dorsal aspect at the junction of the ascending and horizontal part. The trapezoid part, it attaches to the trapezoid ridge on the upper surface of the horizontal part of the coracoid process. Coracoacromial ligament is attached to the lateral border of the horizontal part in front and behind. Coracohumeral ligament from the middle part between the attachment of the coracoacromial ligament. Now I discuss some important question from scapula. Tell me the attachment of the supraglenoid and infraglenoid tubercle. The attachment of the supraglenoid tubercle is long head of the biceps brachii muscle, and attachment of the infraglenoid tubercle is the long head of the triceps brachii muscle. The long head of the biceps brachii muscle is the muscle of the anterior compartment of the arm, and long head of the triceps muscle is the muscle of posterior compartment of the arm. What is the peculiarity of the long head of the biceps muscle? It is intercapsular but extrasynovial. What are the other intercapsular muscle present in our body? Lateral head of the pterygoid and popliteus muscle. What type of epiphysis the coracoid process is and why? Coracoid process is the example of atavistic epiphysis. You know the definition of the epiphysis? Epiphysis is the part of growing long bone which ossify from the secondary ossification center. Bone is a cartilaginous model, and this cartilaginous model is converted into bones. Initially, a part of the bone is converted into bone, and this is known as the primary ossification center. After the formation of bones from the primary ossification center, any center appear is known as the secondary ossification center. So there is a lot of type of epiphysis present. For example, pressure epiphysis, which transmit body weight; traction epiphysis, which appear due to the pull of the muscle, and this is one of the exceptional epiphysis, the coracoid process, known as the atavistic epiphysis. Actually, its main this coracoid process is at first developmentally it is the independent bone, which is later united with the scapula and ossified and it is due to the nutritional purpose is united with the scapula, and this bone is ossified from different ossification center. How the suprascapular notch is converted into foramen? It is converted into foramen by the superior transverse ligament. What are the movements of the scapula? Protraction, retraction, elevation, depression, medial rotation, and lateral rotation. What are the climbing muscle attached with the scapula? Serratus anterior, pectoralis major. Tell me about the anastomosis present around the scapula. There are two anastomosis present in scapula. The anastomosis around the body of the scapula, anastomosis over the acromion process. Now, the formation of this anastomosis around the body of the scapula is formed by the suprascapular artery, branch of the thyrocervical trunk, deep transverse cervical artery, branch of the thyrocervical trunk, circumflex scapular artery, branch of the subscapular artery. Now, the anastomosis over the acromion process. The branches are the acromial branch of the thoracoacromial artery, acromial branch of the suprascapular artery, acromial branch of the posterior circumflex humeral artery. Important of this anastomosis. It is important. It causes from the collateral circulation uh, is established through this anastomosis when distal part of the subclavian artery or proximal part of the axillary artery is blocked. Why the lateral border of the scapula is thick? Because it acts as a fulcrum during rotation of the scapula. The location of the coracoid process in living body. The tip of the coracoid process can be palpated 2.5 cm below the junction of lateral 1/4 and medial 3/4 of the clavicle. In reptile, coracoid process is separate bone, but in human, due to the nutritional purpose, it attaches with the scapula. The first coracoid center represent precoracoidal element and second choroid, the subcoracoid center represent coracoid proper of the reptilian girdle. The clinical anatomy related with scapula. The prinzal deformity of the scapula, congenital high scapula. The scapula develops in the neck region during intrauterine life and then migrates downward to its adult position, the upper part of the back of the chest. The failure of the descent led to springal deformity of the scapula. In this condition, scapula is hypoplastic and situated in the neck region. It may be connected to the cervical part of the vertebral column by a fibrous cartilaginous or bony bar called the omovertebral body. An attempt to bring down the scapula by a surgical procedure may cause injury to the brachial plexus. So this is all about scapula. If you like this podcast, please share this postcard and please subscribe my channel. Thank you for watching.